I'm Natasha Tracy for Breaking Bipolar at healthyplace.com. So I've been thinking a lot about my bipolar can and can't list. So things that I can do in spite of bipolar and things that I can't do because of bipolar. And some days it feels like my can't list is massive. Other days it feels like my can list is okay. But what I think that I have to remember, and everyone has to remember, is that every single person on the planet has a can list and a can't list. We all have things that we just can't do, either due to circumstance or simply because we don't have the will to do them. So you might look at a family person, someone who's married, has a couple of kids, has a front lawn and a picket fence, for example. Well, that person might, for example, not be able to become an astronaut just because they're in a situation where being an astronaut just wouldn't make sense for them. They'd have to be away from their family for a year at a time, something like that. So I can't be an astronaut either. Not just because I am of an age where that wouldn't make a lot of sense, but also because I have bipolar disorder. And to the best of my knowledge, you can't become an astronaut and be medicated like that. So my point is, anything can be on your can't list because of bipolar, but it could be on someone else's can't list just because of their own life circumstances. So when it feels like you can't do anything because of bipolar disorder, and I know this feeling, I know the feeling that bipolar disorder has taken away so much of your life that it feels like there's nothing left. When you do feel this way, try to remember that every single person has a can't list. And those can't lists might be because of physical disability, or it could be because of life circumstances, or it could be because of their environment, or it could be because of their history. It could be because of a lot of things. So I need to focus on the can list. I can do things like speak at conferences in a room full of 600 people. I can do that. Bipolar does not stop me from doing that. I can write. I'm a writer. It's what I do. Bipolar doesn't stop me from doing that. When it comes to can'ts, yeah, I can't write as much as maybe some of my fellow writers because I don't have the stamina. My bipolar and my medication tends to make me really tired and make me require more rest than the average person. Similarly, if I choose to speak at a conference that's all the way across the country, then I will likely have to rest for a day when I come back. Again, your average person probably wouldn't have to do that, but I with bipolar disorder would. Nevertheless, the cans in that picture outweigh the can'ts. And I just have to frame things that way. So what can you do with bipolar? What can't you do with bipolar that you can reframe? Comment below. My name is Natasha Tracy, and this is Breaking Bipolar.